This is a good friend and colleague, Dr. Nicky Kirk. He was kind enough to let me use this video that we shot to show an evaluative process that I like, and we used for right chronic ankle issues. And I wanted to show some of the tools that I like to use with Spark Motion when I'm doing a movement assessment. First thing I like to do is just observation, and I like to use the grid for that. It's sizable, so many times what I'll do is I'll just size it until we can get it to fit the size of the knees, and I'll just sort of center it on the shaft of the tibia. And what I'm looking at is the external rotation, if I can get that centered nicely, of each leg, and whether one foot is slightly more externally rotated than the other. In this case, we can see that Nicky's right foot is slightly more externally rotated, and the patella is more laterally rotated than is the left side. So now I'll just have him real time. I'll have him square his feet up, and I just want to watch him go through a squat real time. And there's a few things I'm looking at, and yes, we can do overhead, all sorts of different things. The first thing I want to just see is what's his strategy. If I use the slow motion tool, what you see is, if you watch those big toes, is as he goes into a squat, and we're just sort of going frame by frame here, you'll see that he will pick up the big toe as he starts to initiate the squat. And that's sort of an interesting thing, because it explains that he's probably shifting his weight way posterior and just working really hard to keep himself on the ground. And you see those, especially that right big toe, but the left one too, they're really popping off the floor. Quick angle change, we'll just watch him squat again. And yes, you can see the toes are up. Although he has the strength to maintain it, there is virtually no ankle dorsiflexion. The tool I'll use quite a bit is just the angle tool that I just dropped here. And I'm not so much looking for the exact measurement of the angle. What I'm looking for is, and I'm just winding him back out of the squat just a little bit, is if we place this tool properly to begin with, and I can have a steady hand when I'm shooting, as he's squatting, notice how virtually no dorsiflexion is occurring. And so I'll add one of my favorite tools, the pointers here, and you can see that the angle here doesn't change at all. It's the rest of the squat's occurring here. So I'm really worried about limited ankle dorsiflexion, and so we want to see if that's a problem. We can isolate that out by just simply having him squat again. And again, what we can see is if we want to drop that angle, and I want to show you that I can either have the gray on this side of things, which can be helpful. Sorry, let me get that right. So we can have the gray here, or I can flip this around so that the gray doesn't block the view, and still get the opposite angle measure. And I really like that feature as well. But again, we see that little to no ankle dorsiflexion is occurring. And when we do it this way, we simply isolate the calf out away from the opposite leg. So now I'm going to ask Nicky to just take a walk, and we'll just watch him walk down for a minute. And what I like to do here, again, is I like to just get this grid. I find it helpful if I can keep a steady hand to just sort of place that grid right over his SI joints, and that's why his shirt is tucked in and his pants are pulled up a bit, so we're right on the joint. And we can just watch him walk. And again, as we move that and we go slowly, we can see, is there hip or pelvis translation? What are the feet up to? And so if we watch that one more, see is just that his right leg is turned out more, and that he looks to get very little rotation and possibly lateral flexion at the hip. So my next move is to do a crossover step, just looking to see what he can do. Now, if we go frame by frame, which I really like, as I've mentioned before, it's one of my favorite tools, is we can see that he really does not evert through this foot as it strikes the ground. And as that hip is coming across, we can see that he's getting some limited hip adduction, and so the spine is actually side bending and rotating towards us, and it just does not look smooth. So if we watch it on both sides, and then we'll see, he'll sort of point to that hip at the end, because he feels that he's just not getting through that as he comes through. So let's watch that in half speed. So if we watch it in half speed, we can watch the motion, but we can see that he gets a little adduction and then boom, hits hard. So now we'll just evaluate the toe function. Here I'm just looking at great toe extension. Nicky comes up. I don't care about exact numbers, but we look at the amount of great toe extension that Nicky's getting on this left foot, and we'll compare that to the right. Here we go, real speed. Whoop, and he pops up real soon, actually a lot sooner than on the other side. So let's drop that back down to about that appropriate spot. We'll kind of put the angle at the joint there and bring it around this way. Again, just to be consistent, we'll turn it so that we don't block actually the view of the foot. And obviously you can see we have a much smaller angle of great toe extension. And then finally I like to do a little bit of a treadmill walk, and I'll do this in slow motion for a minute just so that we can watch it. And you see the big toes stay hyperextended, and that on this left more than right, we're not pronating much, we're not getting much calcaneal eversion, and that midfoot stays quite rigid and locked. And he's landing in a quite externally rotated position, so as we strike, hard to get to the ground with that foot. This side, slightly more effective. So I think we have a nice set of puzzle pieces, and so then we can go ahead and treat Nicky and understand using spark motion pre and post to see if we've actually not only objectively seen a change, because subjectively he may feel better, but objectively we may not see a major change, or we may see a substantial change in spite of him not feeling better. And so that's the beauty of using spark motion and these tools to educate your patients.